A C-section is the only major abdominal surgery where they hand you a human baby afterwards and say, "Good luck." If you had a belly birth, your recovery is fundamentally different from a vaginal birth. You have 7 layers of tissue: skin, fat, fascia, muscle, and uterus that were cut and need to knit back together. Society sometimes treats C-sections as the easy way out. That is nonsense. You are recovering from major surgery while sleep-deprived. Today, I am giving you the survival guide for the first 6 weeks, covering everything from the incision to the C-section shelf. Movement and the lift limit. Rule number 1. Protect your core. Your abdominal muscles have been separated. The lift limit. Do not lift anything heavier than your baby. That means no car seats, no laundry baskets, and the hardest one, no picking up your toddler. Sit on the couch and let the toddler climb up to you. The log roll. Getting out of bed is the hardest part of the day. Do not do a sit-up. It puts massive strain on your stitches. Technique. Roll onto your side. Drop your legs off the edge of the bed. Push your upper body up with your arms. Keep your core quiet. The cough pillow. If you need to cough, sneeze, or laugh, hug a pillow tight against your incision. This splinting provides counter pressure so it doesn't feel like you are popping open. Incision care and hygiene. Let's talk about the scar. For the first few weeks, your goal is simple. Keep it dry. Moisture is the enemy. The shower. It's okay to shower. Let soapy water run over the incision, but don't scrub it. The drying trick. After the shower, do not rub with a towel. Use a hairdryer on the cool setting to blow air on the incision until it is bone dry. Monitoring. Look at your incision daily in the mirror. If you see redness spreading, oozing pus, or if the area feels hot to the touch, call your doctor. That is an infection. Clothing. Wear high-waisted underwear or C-section-specific panties. You do not want a waistband rubbing directly on that wound. Pain management. You will be in pain. Do not be a hero. Stay ahead of the pain. If your prescription says, take every 6 hours, take it every 6 hours. If you wait until you are in agony, it takes much longer to bring the pain down. Set an alarm on your phone. The gas pain. You might feel sharp pain in your shoulders. This is trapped gas from the surgery traveling up your diaphragm. It is excruciating. The fix. Painkillers won't fix gas. You need peppermint tea and movement. Walk slowly around the house. It gets the gas moving. Scar massage and desensitization. Once your incision is fully closed, usually 6 weeks, you need to touch it. I know, it feels weird and numb. Desensitization. Start by lightly brushing the area with a soft cloth to wake up the nerves. Scar massage. To prevent the C-section shelf, that overhang of skin, you need to massage the scar tissue so it doesn't stick to the muscle below. Technique. Use vitamin E oil or silicone sheets. Gently move the skin around the scar in circles. This breaks up adhesions and helps the scar lay flat. Numbness. It is normal to have numbness around the scar for months or even years. Nerves take a long time to heal. The emotional toll. We need to talk about the emotional side. Maybe you planned this C-section. Maybe it was an emergency and you feel like your body failed you. It is okay to mourn the birth you wanted. It is okay to feel disappointed, even if the baby is healthy. Birth trauma. If you have flashbacks to the surgery or feel panic, please talk to a therapist. Birth trauma is real. Bonding. A C-section does not ruin your bond. You can still do skin-to-skin. You can still breastfeed. Use the football hold to keep baby off your incision. Outro. You are a warrior. You were cut open, and you are keeping a human alive. Be gentle with your body. It is doing miraculous work repairing itself. Next, let's talk about fuel. What should you actually be eating to help that tissue heal and support your mood? We're diving into postpartum nutrition next.